Welcome to this episode of Jewish Midlife. Hi, I'm Javara Kresniansky, and today we're tackling a topic often overlooked, addressing Tahara issues during perimenopause. Rabbis and Rebbetzins who deal with Taharas Mishpacha have expressed that many women don't seek solutions for their staining and other Tahara issues, and often remain in the nida state for weeks or months. But there are solutions for challenges like staining, extended periods, heavy bleeding, and short intervals between bleeding during perimenopause. Joining me is Rabbi Dovid Bartfeld from Tahareinu to discuss perimenopause through the lens of Tahara, not through Halacha, but rather focusing on medical and natural interventions to discuss with your healthcare provider. So if you're experiencing bleeding and have Tahara issues, this is a very important episode for you. I really want to thank you, Rabbi Bartfeld, for this important conversation. And there's so much that we can talk about, so I hope that we can get a lot into this conversation. But as we start, I think it's valuable to talk about what the work that we do in Tahareinu and what we're going to be talking about and what we're not going to be talking about in this conversation.
First of all, thank you very much for the opportunity to be here and share a little bit about what Tahareinu does. Tahareinu is an organization that is there really to help women throughout the entire life cycle with Tahara-related questions. So, I think the numbers are very high up there. I don't know if it's over 98% of Jewish women will experience a Tahara-related issue at some point in their life cycle. And it could be something as simple as a kala, just making sure that she doesn't have a Lysteda, which, there are doctors in different communities that deal with that. But not every community has that luxury. And going through pregnancies and, contraception, fertility as it relates to Tahara, and all the way through perimenopause and menopause. And through each stage, women do experience here and there issues with staining, with cycles and bleeding and things like that. The medical community has actually come a long way over the past, I would say, 5 years. Used to be there was really nothing. Like you would call a doctor that has no shaykhs to Shmiras Tahara, and they're like, there's nothing wrong with you. You're medically okay. The fact that you're staining is an inconvenience, but it wasn't ever looked at as a medical issue. Now, quality of life, there is a terminology out there called AUB, which is, stands for abnormal uterine bleeding. It's something that the medical field has now taken on as an issue. Obviously, it's a work in progress. The Tahareinu hotline is primarily hotline, which is currently being answered by over 50 women. So this is highly trained advisors that go through a rigorous training in the we'll call it the Tahara field, the medical Tahara field, the reproductive field as it relates to Tahara. This is not a halacha hotline. I can't stress that enough. We very much tell our advisors that all halachic questions are, even if you know the answer, we specifically do not answer halacha questions. That's for the Rabbanim. We send all the halacha back to the Rabbanim, but women call when they're experiencing issues and they are able to speak with a woman advisor, which is, very helpful for them to feel that connection and somebody who understands them and be able to really get practical medical advice on what they are experiencing. And it's been a tremendously positive experience. We've had doctors reach out to us from all over the world, from the U.S., from Eretz Yisrael, everywhere, that, their patients that have called Tahareinu, a doctor, depending on which part of the world and what the insurance allows for, a doctor's visit is really not, they don't have the time. They have, 10, 15, 20 patients waiting for them. And they don't have the time to give you a shear on, why you're experiencing what you're experiencing. They just want to get through it and go to the next one. And as they say, it's mamash a pleasure to deal with patients that are educated, that have spoken to Tahareinu, that are, they're in the know, they're empowered, And that's really what it's all about. It's about empowering women, empowering families to really know, the different options out there, what the reasons for what they could be experiencing. A lot of times a referral to a doctor maybe that does a procedure that could help them. We'll speak about that a little bit. And so that is the Tahareinu hotline in a nutshell. We do go around, we do training for Kala teachers, we do training for Chassan Rebbeim and Rabbanim on, these types of topics to help them, especially Rabbanim that deal with this on a daily basis, Rabbanim that deal with couples and they're paskening shilas. And a lot of times, it's very easy for a Rav to just look at a Badika and look at a Kesson and say it's not good, it's not good. But to be able to actually understand when what this person is doing it doesn't make sense, and perhaps direct them either to call the hotline or perhaps you're experiencing this, perhaps that, and giving them that hadracha to help them get the help. So it's not just about usher or mutter, but actually get some help along the way is extremely helpful. So that's Tahareinu in a nutshell.
It's such an important service, and from my experience, the medical knowledge that the people of Tahareinu have is so phenomenal. So I'm really excited to be talking to you today because there's so much that's happening in midlife with perimenopause and menopause that is separate from the work that Tahareinu does with fertility and kalas. And I think that from my experience with people that I speak to, there's people have questions, but they don't know that they should be asking halacha. They should be asking the Rav. Sometimes they just say, okay, whatever, I'll just be nida. And I think that there's so much that can be done, and there's so much that they can understand that I think that this conversation will be super important. So let's just jump
100%.
right into nida as it relates to menopause, or just anything that's as it relates to menopause, the work that Tahareinu is doing.
So yeah, really that's important point. Menopause and perimenopause really is a stage in life that does come with a lot of questions, and it's important for women to understand the different stages and what can come with them. Different issues that do come up. So we'll call in the premenopause, I guess part of the thing is to know that we're talking about like a decade. Each there's a very big overlap. So no two women are the same, obviously, and you could have women that are 50 and are already in menopause, and you could have women that are 58 and they're still getting their cycle. Again, not as common, but it's possible. There's a very big we'll call it almost a 25-year, a quarter of a century, really, that can encompass the from premenopause through perimenopause and menopause, depending on the woman. So there's a few things that I would want to mention. I think that are really important to mention. Number one is a woman that is under the age of 40, really where she should be is in her premenopause stage. And she's experiencing, somebody's 35 or sometimes even younger. Really, this applies to any age during childbearing years. And she's experiencing, the lapse in periods, what may seem to feel like maybe, what we call a really premature, we'll call it premature menopause. It's important to really get that checked out, because sometimes, if a woman doesn't have a period for a bunch of months, again, it could be other things. It could be PCOS, she could be pregnant. We don't know, but it's important to get it checked out, because there is something out there, POF, which is premature ovarian failure, which is a syndrome that does affect. It's not common, but it can affect. It's basically where the body kind of does go into this menopause type of stage, and the ovaries are failing, and it's irreversible. Current medical medicine does not have a way how to fix that. So if we catch it early enough, and a lot of times women, they call a couple of years later, they're already mamish at that point. There's really nothing to do for them. But if you catch it early enough, a lot of times there's things that we could do to freeze eggs and things like that to be able to help, a woman still have the nice Jewish family that they want to have, and they don't realize that they're having this premature ovarian failure. This is something that is just important to just keep out there really for all ages to know. Now, the different stages, we'll call perimenopause, which is somewhere between ages 35, 40 to 50. Um, what it what it what it really is marked by is a decline in the ovaries. The ovaries are what produce the hormones, estrogen and progesterone, come from the ovaries, and that is the main, we'll call, female hormones that keep everything going. And as a woman ages, so the function of the ovaries slowly declines. And that comes again with its whole host of different side effects that happen. The number of follicles that are in each ovary are decreasing. Less estrogen and progesterone are produced. The follicles are weaker. And because of that, ovulation becomes irregular, which will result in irregular cycles. Now, to establish, that a woman has entered menopause, is usually a blood test that shows that a woman who has very high FSH, follicle stimulating hormone, means that the body is the brain. That's a hormone that comes from the brain. The brain is producing this hormone to stimulate the follicles to produce estrogen and progesterone. Just the ovaries simply are not functioning well enough to do that. So the brain is producing more and more. So a woman that has a high level of FSH, which is the follicle stimulating hormone, that would be a good indication that a woman has entered menopause. At that point, meaning at a point where the hormones are that high, FSH, that's a clear indication that she's getting to that stage of there's no estrogen being produced, no progesterone, or lower progesterone, and that comes also with its own set of side effects, right? The hot flashes, dryness, irregular cycles, staining, mood swings, lower libido, and disturbed sleep. These types of symptoms do come from the drop in estrogen and the drop in progesterone. And it's like kind of withdrawal symptoms from this hormone that are causing all these side effects. I guess one of the big questions, we really there's a few things that should be discussed. One of the big debates is HRT, or what is known as hormone replacement therapy. One of the ways how we could help a woman that is entering the stage of perimenopause, and a lot of times what will happen is that they're going to get very heavy bleeding, very, very heavy bleeding. Sometimes it could even be a period every 2-3 weeks. And this is something that is mitzad echad. Sometimes it could be the lack, it'll be maybe much lighter, but the heat flashes and things like that are sitting heavily on a person, and each woman is different. So there's no one size fits all. But there's a big debate amongst doctors and in the medical community about the benefits of HRT, of replacing the hormones that are declining. So the estrogen and progesterone that are declining, to replace that, to be able to take, really, it's technically a birth control pill, would be replacing the hormones that the body's not producing anymore. The reason in the medical community that it was always accepted to try to shy away from giving women, especially over the age of 40, 45, the main concern of the doctors that are not for giving estrogen and progesterone like HRT to women, because they feel there's an increased risk for cancer by taking these hormones. But as studies have continued, it seems, I mean, there might be an elevated risk, but it's not what they thought it was. Meaning the risk is definitely not as high as they thought it was. And it's definitely mitigated by the host of other benefits to taking HRT. Having estrogen and progesterone replaced is extremely helpful in a lot of different areas. It could help with bone density issues. Women who develop osteoporosis later on, this could help cardiovascular issues that come with a lack of estrogen. There's a lot of side benefits that replacing those hormones, that taking HRT do have that benefit that highly outweigh also even just the whole Tahara issue. That's where kind of Tahareinu fuses. But having a cycle, and again, it doesn't have to be a monthly cycle. It could be every 3-4 months. You could take the pill for 3-4 months at a shot, and then get a cycle every 3-4 months. That's fine. But having these hormones replaced does have a lot of benefits to it. So again, it's something that each woman should discuss with her doctor. Obviously, if there's a predisposition to certain cancers, if it runs in the family, that would definitely be something that would be taken into account. But I would definitely say that it's not cut and dry one way or the other. It's something that the women have to know that these are options available.
And so HRT would help with Tahara and keep the cycles more regular and
correct.
Quite possibly help with the staining. To use this HRT. Is there names of this medication, or is it just all under one umbrella?
Yeah, whatever the doctor. There's a lot of generic ones out there.
Are we talking about birth control pills, or are we talking about the patch?
Yeah, really. So the patch specifically, sometimes we find is not as great with the staining. So even though the patch would help for the hormone part of it, but when it comes to the staining part of it, a lot of times the patch is not good enough. So I'm not crazy about the patch, but for some women it does work. And really, again, it would have to be weighed with the pros and cons of all different types out there. But again, it's definitely an option that should be on the table for those that it will be helpful to use.
And it's also it is a contraception after all. It's a birth control pill, so that it does deal with that. So if someone is trying to regulate their cycle and trying to get pregnant, HRT is not the way to go.
Usually not, correct. Usually not. Although there are ways sometimes how to give it, maybe just the estrogen in the beginning of the month and then progesterone afterwards, that might be able to work in conjunction with trying to get pregnant. But again, that would be a per case situation. Usually, at some, I guess at some age, I don't know what the official cutoff point is, but women at some age, they're not sure if they're at the I don't know if it's a comfort thing or again, this is something that should be discussed with a Rav, but about what point do they accept the fact that they're not having or they're not trying to have any more children, and how does that play into which hormones they would try to take.
Okay. So let's talk about someone who's staining a lot. They're not trying to get pregnant, and they're having a lot of heavy bleeding. What can they be doing?
Okay, so like this. So that's a very good question. Basically, there are a few different things that they can try. So we mentioned HRT as one possibility, which would be replacing both estrogen and progesterone.
And that's very important to make sure that there's the progesterone part too. Because some of the pills just estrogen pills, but if you don't have the progesterone, then you're
going to be imbalanced, and that's going to cause right. Now, another thing that women do sometimes is just progesterone. Actually, there's a pill called Agestin, which is progesterone only, and that is very good with just the staining. Meaning, when it comes to perhaps all the other symptoms and everything else that they may be experiencing, this might not be the answer to that. When it comes to specifically staining, especially I guess we'll call it in the earlier 40s, this is something that women will try sometimes to just take a higher dose of progesterone. With that, there is a IUD, a hormonal IUD called Mirena, which is a progesterone only, it's a progesterone, it's an IUD that has progesterone in it. Now, it's interesting because when, for women that are in their childbearing years, a lot of times we advise them to stay away from the hormonal IUDs because it takes about 6 to 9 months, sometimes, not always, but it takes about 6 to 9 months for the body to get used to it. And during those 6 to 9 months, it could come with a lot of staining. So a lot of times we'll tell, a woman that's in her childbearing years that needs a year or two break only, and they're looking for an IUD just because they don't want to be busy with the pill or whatever it may be. But the doctors push the hormonal IUDs because they say you're not going to get a period on it, or you'll get only very light periods. And this is something that speaks to women. But mitzat sheni, the doctors never mention that it could take 6 to 9 months till you get to that blissful place where you're not getting a period. And it's 6 to 9 months of literally, we've had women that call 6 months in. They never heard, they didn't know about Tahareinu hotline. Finally, somebody gave them a number, and they literally have not been to the mikvah in 6 months. And it's a scary, it's ma'aseh b'chol yom. It's one of the most common questions on the hotline is the hormonal IUD. So as it pertains to the younger years, we usually tell women there's no reason to invest 6 to 9 months on something that you're only keeping for a year or two. But when it comes to perimenopause, then actually there is a very nice place for the hormonal IUD. Because again, what it does, it's a IUD, so it's an intrauterine device. It's placed inside the uterus, and it releases traces of progesterone directly into the uterus. And what this does is it slowly thins out the lining. So yes, it might take 6 to 9 months of managing it, perhaps with agestin, with progesterone pills and things like that, till a woman, her body gets used to it. But for women that have extremely heavy, they transition into their perimenopause with very heavy periods, very heavy bleeding. And it used to be that doctors were saying left and right, just do a hysterectomy and get rid of the uterus. There's nothing we could do for you. And this is something that is really very easily available. It's an easy fix. And for a lot of women that are experiencing that heavy bleeding, that heavy staining, this is the fix. And it will take it might take a half a year for them managing it with the progesterone pills till their body gets used to it. But from that point on, their lining is thinned out and it stays in there for 5+ years. And for those 5 years, either she won't be getting a period at all or very light periods, but it's extremely effective for the perimenopause, for the aspect, we'll call it, of the perimenopause, to be able to use a hormonal IUD during that stage. That's another thing that is extremely beneficial.
So just to ask, so in those 6 months, you will be having neither questions on staining, or with the kind of balances out a little bit better?
Yeah, so if they do experience issues, they call the hotline, and usually what we'll advise them to do is to take the agestin, the progesterone pills. It's usually about 6 to 8 weeks at a shot. While they're taking it, it's amazing. Like they work. So the pills work and they mitigate the staining. And then we tell them after 6 to 8 weeks, so you have like menuchas and nefesh for a little bit, then they'll go off it. The drop in progesterone from the pills will cause a period of some sort, depending on what was there to begin with. And then we see, if they're able to regulate, their body is able to regulate without anything, great. If not, if they can't get clean after a period of time, so we'll say do another regimen of 6 to 8 weeks, and usually within 6 months, their body is used to it, and then they don't need the pills, and then they're just on the IUD, and they can be like that for the next 5-6 years. or whatever is necessary until until they enter proper menopause.
Why would someone choose the IUD over an ablation?
So let's speak
And
about
let's describe
ablation.
what an
So
ablation is. Yeah.
yeah, so endometrial ablation would be another, again, used to be a hysterectomy. That was it. A woman that was having serious Tahara issues, they would just cut out the entire uterus. And that's something that we really try to avoid whenever possible. Sometimes there's a cancer in there, or whatever it is, and it has to be dealt with. But in general, we really very much try to avoid hysterectomies when possible. It takes a toll, it takes an emotional toll as well. Endometrial ablation is a very nice substitute, we'll call it, to extreme or heavy duty cases where there's a lot of staining, very heavy periods, and things like that. What they do is they burn out the lining. It's a fairly simple outpatient procedure. It does not take a long time, and there are many ways how to do it. They have sometimes like a roller that they just roll around and burn out the lining. They have different instruments that they could insert that kind of heat up, microwave or whatever it is, but they could heat up the inside of the uterus, the lining, we'll call it, of the uterus, and burn it out. But essentially, what that does is it gets rid of the endometrium, which is the endometrial lining, which is, again, the lining is where the period comes from. So the uterus on the inside has a lining, and throughout a woman's childbearing years, whenever her body produces estrogen, that causes the lining to grow, essentially preparing it for a fertilized egg. And the progesterone actually thickens and makes the lining stronger during the second half of the cycle, preparing it for that fertilized egg. If for whatever reason there is no pregnancy, there's no fertilized egg, so then that lining will shed. There's a drop in hormones, which brings the shedding of that lining, and that is damnida. That is essentially, that lining is damnida. What ends up happening is, during perimenopause, because the hormones are all over the place, that lining could be extremely thick and could fall apart much more often, cause staining. Again, there's a lot that can happen during perimenopause that could cause, wreak havoc on Tahara life. Burning out the lining, doing an endometrial ablation, what that does is it gets rid of the lining. Most cases, I don't know what the percentage is, maybe 80% of women that do an endometrial ablation will not even get a period anymore. There is a small percentage, 15-20% of women that will still get some sort of small period. But again, the most common is when they do it properly and they do burn out all the tissue properly. What that is supposed to stop a woman from getting a period entirely, but her uterus is still there, the ovaries are still there, everything is still there, and it's just kind of getting rid of the Tahara issues, the Tahara problems that may come from the hormones being out of whack. But it's not going to help on a hormonal level. It's not going to help, but on a Tahara level, it makes the whole difference. So that is a very nice another option. I guess halachically it would be at least a question that should be posed to a Rav. But derech klal, the answer is to go ahead and do it. The shaila is what's called sirus nashim, to making a woman infertile is a shaila, and the question is over here, doing an endometrial ablation, how much of, is it a psikresha? Is it is it for sure going to make her that she can't have children? The age obviously makes a very big difference, but in general, Rabbanim do allow to do an endometrial ablation, and for many women, this is a very good option for Tahara issues when they're going through the perimenopause stage. So that is another option out there. So we have HRT, we have the hormonal IUD, which is one nice option. We have endometrial ablation. Hysterectomy, where they're going to remove the uterus, is something, again, as mentioned, we try to avoid. Sometimes when, some women will develop very large fibroids and myomas and growths inside the uterus, that we've had women that call that they look pregnant from the amount of growths that they had in their uterus. And again, different women will their bodies react differently to the hormones that they're producing later on. And in some extreme cases, that will be the only answer, is to do a hysterectomy. But again, as mentioned, we definitely try to do that as a last resort. There's a lot of medication out there. There's a lot of different innovations going on. I didn't even mention, but sometimes you can have polyps or growths or myomas and things like that, fibroids that are not that big, but they can cause, especially later on during the perimenopause stage, even if the hormones are more or less stable, if a woman does have a growth, a polyp, something in there, it can cause a lot of staining issues. So lav dafka does she have to be experiencing major perimenopause side effects to have Tahara issues. Fibroid or something like that, inside the uterus can create Tahara issues. And Baruch Hashem, we'll call Achshar Dara, the medical community has, in this aspect, has really come a very long way. What used to be the only medical procedure that doctors would do, even 5, 6, 7 years ago, was what's called DNC, dilation and curettage, which is basically where they scrape out the entire contents of the uterus. And this was their one size fits all fix for things that were growing in the uterus, for any issues, for after births that were miscarriages and things like that. And that is a very, we'll call it a very aggressive procedure. But Baruch Hashem, nowadays there's something called a hysteroscopy. Hysteroscopy is where they are able to insert a small fiber optic camera that comes with tools, and it's amazing. Like the technology, it's like a laparoscopic surgery where they have these tiny little tools. But it's not done laparoscopically; it's done, through the uterus. So they're not even making any incisions. It's literally inserted, into the uterus, and they're able to see the polyps, see the fibroids, growths, anything in there. And they have these little tools. They're able to cut exactly only what the issue is, leave everything else intact, not check with anything else. This is a 15-minute procedure that could, change dramatically. Again, it used to be we would either throw hormones at a woman, right? She has this growth, she has something in there that there's nothing we could do about, right? So we'll give a high dose of progesterone just to try to keep hold everything in together, But Baruch Hashem, nowadays, because of this innovation, this is a tremendous tool for it. I would say that a large success of the Tahareinu hotline over the past, I would say, 5 years has been being able to direct women that have these types of, we'll call them physical. It's not just a hormonal issue, but a physical issue that's there, to be able to direct them to get a hysteroscopy done where they could remove it in a 15-minute outpatient procedure, in and out. This is a very, very helpful tool as well.
Wow, it's amazing technology. So for someone who doesn't want to do something pharmaceutical or surgical, are there any natural or other things that they could be trying at least or taking?
Let's see, what do we have on the natural? When it comes to natural things, we'll call it light staining, a woman that's experiencing very light staining, there is a vitamin out there that's called bioflavonoid complex, which is for any woman at any age that's experiencing light staining. Bioflavonoid complex is made from the peels of citrus fruits, and it's not vitamin C, but it strengthens small blood vessels. And it can be the official dose that we find helps is 1,000 milligrams 3 times a day. And that could be very helpful for a woman that's just having a little bit of light staining here and there. That could just be a natural, no hormones, nothing heavy way how to deal with it. We've actually, over the years, we've had these chus of going around to different gedalim. Baruch Hashem, Tahareinu is worldwide accepted by the gedalim and the paiskim, the rabbanim community around the world, Baruch Hashem. throughout the years, we've had this chus to be endorsed by many such gdalim. One of them was Rabbi Belsky, who was known, besides for being a Rosh Yeshiva and a massive Talmid Chacham, was also world renowned for his knowledge and everything about everything. He really was unique in that way, that he just knew everything. When we went to talk about Tahareinu, we're discussing different solutions for staining, and we have happened to have mentioned this bioflavonoid complex. He gives a big smile and he says, "Oh, bioflavonoid complex." He says, 40 years ago, he tells us he had a Talmud in his yeshiva in Terah Vadas that had nosebleed issue. And they tried cauterizing, they tried all different things, and he couldn't figure out what to do for him. So he did research into it, and he came out that the solution is going to be this vitamin called bioflavonoid complex. And he put him on a regimen of bioflavonoid complex, and that actually solved his nosebleed issue. And what it does is, again, it strengthens the small blood vessels, which are very helpful in staining. So it's not going to stop a period, and it's women that are experiencing very heavy bleeding. It's not gonna do it for them. But again, if it's just the light staining, it's great for cleaning up after birth and things like that. This could actually be a very natural way how to go, how to um, try to avoid at least the Tahara issues. And again, there's a whole gamut of natural supplements out there that may help. Vitex is good for regulating hormones, a natural supplement. It's called Agnes Castus or Vitex. In Hebrew, it's called Siach Avraham, which is, again, it's very helpful. There are natural supplements. You go to your local vitamin shop or whatever it's called, your health food store. I'm sure there are different things that you can try.
What about plant-based
Each
estrogen? Would that be helpful?
For some, yeah. For some women, they find it's drops, right? It comes in drops or things like that. Some women do find that helpful.
Well, soy is also a plant-based estrogen.
Correct.
I mean, it's
Um,
much less potent than our estrogen, but it's something.
right. And there's nothing wrong with experimenting and trying. Call Tahareinu, they're going to walk you through what the options are. So, I mean, there's over 200 pills currently being sold in America that and they're all making money. So, right. So, not all of them are good for staining, and not all of them are good for women that want to be Shemer Tahara. So they'll call the hotline and they'll get the advice which pills to use. So meaning that there's no one size fits all. And a lot of times we'll get couples that call in and they'll say, we don't do we tried pills last time and it didn't work. And we have to explain to them there's literally 200 different pills. I mean, not all 200 are different, but there's a very large amount of differences. There's different generations of progesterone. There's different dosages of estrogen. So yeah, you have to be willing. If you're willing to kind of experiment and find what works for you, then it might take a few months or longer till the person figures out. But there's nothing wrong with experimenting a little bit and figuring out what the exact thing that's going to work for each person. And we definitely recommend not giving up just because they tried one. Unfortunately, there is no one size fits all answer for Tahara. Wish it would be that easy. There's no one magical pill that just cures Tahara issues. I mean, there is a pill that actually does stop bleeding, but
I want to talk about that one actually. For some people, like they absolutely need to stop their bleeding for whatever reasons, and so
yeah, yeah,
that pill.
yeah. So that pill is called Lysteda in America. It's basically tranexamic acid. Um, the pill form of this pill was made for women that there is a condition out there where women get their period and they bleed so much that they become anemic. They lose so much blood that they mamish b'sakana. So this pill was created that to just slow down blood flow. And basically, all it does, non-hormonal at all it does is thicken the blood. So if there was one magical pill that literally stopped bleeding, it would be this. They give it in IV form for patients that are doing open heart surgery to just slow the bleeding down so they don't bleed out under the knife. This is the miracle Tahara pill. Unfortunately, well, obviously, if anybody has any clotting condition, family history of blood clots or anything like that, they are no way able to take such a pill. In general, doctors will not give more than a 5 to 7 day, regimen of this pill. But in situations where, like you mentioned, the woman is, they're going on vacation, I don't know, whatever it may be, that they need to, stop the bleeding and get to the mikvah, this will work. It will work. And it's not hormonal, it's completely mechanical. You have to take it, it's 2 pills 3 times a day, and it works, and it's great. We use it sometimes for copper IUDs when copper IUDs come with their own side effects, like very heavy periods, much crampier periods, and things like that. And you could add from making a hefsek tire on day 5 to day 8 or 9. So sometimes a little bit of this Lysteda at day 5 could really help a woman make a hefsek tire on time, or maybe a day later, but it really shaves off a couple of days. So it definitely has its uses, and it is available. It's a prescription medication. So yeah, that is definitely something else that is out there and available. I guess it would be incomplete for us to talk about menopause and perimenopause without a little bit talking about dryness, especially women that are trying to do bedikas and things like that. A
Before we
lot
get
of
into
times,
dryness, which is a very important topic, I do want to go back onto this heavy bleeding. I know there are some women who actually did speak to their doctors about their heavy bleeding, and the doctors were kind of saying that this is just regular. And what we're saying is that to advocate for yourself, find out really what's really possible. As you come to the doctor with options and things that I want to try this, I think that you'll get much better service by the doctor. Like there was one woman who told me that her iron was so low, so she actually got iron infusions. And meanwhile, separately, she was talking to her doctor, talking about her heavy bleeding, and he's saying this is regular. And her hematologist was saying that this iron is too low. And when the two doctors spoke, they understood how heavy her bleeding was. She advocated for, eventually worked it through. But some doctors don't listen. And I think that I just wanted to throw that in here, is that
very
there's
important,
coming
very
in
important.
and advocating for yourself. What I understand from Tahareinu is that they can give you some information that you can actually advocate for yourself. So I really want to
Be empowered.
plug for Tahareinu.
Yeah, definitely. To be empowered, it's important to know the information. Try to understand your body 100%. Doctors are amazing and they want to help each patient, but because of time constraints and, each person is different, not always will they give you the time of day. So empowering yourself with the knowledge makes the whole difference, 100%.
Okay. And now let's go back to the next topic of dryness.
Yeah, especially when it comes to Tahara, besides for the discomfort, a woman that is going through perimenopause will, because of the decreased estrogen, and that's directly related to decrease in estrogen, does cause the whole vaginal canal to be much drier. So again, there's discomfort in that as well. When it comes to Tahara, a lot of times that's how they end up calling the hotline, because they can't make bedikas. And what's interesting is it's really not they're not staining, but the vaginal canal is very irritated, very dry, and they're just cutting themselves, they're scratching themselves. So a lot of times they'll just go to a bodeket, and the bodeket could do a bedika without causing much harm. They could do a bedika, check that the what's coming out of the uterus is clear, do it that way. I would assume most women are not too thrilled about going to bodekises on a regular basis, although some women do that. There's really a lot to be done as it comes to just the dryness, depending on the level of it. But sometimes just a little bit of a lubricant could do the job. But in many cases, getting an estrogen cream really is all that a woman needs. And estrase comes in pill form, it comes in cream form, and sometimes it could be suppositories, that could be tablets that are meant to as suppository to be inserted. And just having a little bit of estrogen locally makes a world of a difference when it comes to dryness. So this is something that is a very easy fix. Doesn't have to be a whole complicated thing. It's not that they're going on hormonal pills or anything like that. If it's specifically dryness, that's the issue. Getting a little bit of a cream of estrase or estradiol, estrogen cream will be tremendously helpful. And a lot of times women will find that we've gotten back very nice results, that they go through a regimen, they do a couple months of it or whatever it is, and then they can really upkeep it just with more like just water-based lubricants like KY or something like that. So it's not like it has to be always a long-term thing. Sometimes when they're able to just replenish that lack of moisture, whatever it is, a lot of times it kind of picks up on its own. So again, each woman will have to see on her own, but this is something that you have to be aware of, can be an issue, and it can cause Tahara problems. And even though on a halachic technical level, bedikas, that if it's a bloody bedika, it's a problem. Even though technically, again, a petza in the vaginal canal won't make a woman aser, but it's very difficult to make bedikas when a person is irritated and very dry. So that's something again that's good to keep in mind.
All right. And also, it makes everything uncomfortable afterwards also. So
Correct.
do you have any ideas for libido? Because that's also comes out in perimenopause as a reduced libido because of the low estrogen.
So there is a pill out there. I think it's called Addy, ADDYI, filbanserin. There is a pill out there that officially does help women that have lower libido. The numbers are somewhere in the 50 to 60% will respond to this filbanserin, but it can take up to 8 weeks for full efficacy. There is another interesting thing is testosterone. Believe it or not, even though testosterone is a male hormone, sometimes it can be prescribed off-label to help with what we'll call a lagging libido. So again, it doesn't have to be. It could be transdermally, like a patch or a gel or something like that. It can actually help. I think the studies show that it's transdermal testosterone has been shown to significantly improve low libido with women that are in the menopausal, perimenopausal stage. So that's something to keep in mind. There definitely are AIDs out there. I would say that going back to the mention about natural things, so I do see we have a list here. Just looking at the Tahareinu, we'll call it
Cheat sheet?
the cheat sheet, exactly. We have here, so I mentioned Agnes castus. They have black cohosh. Some women do find that to be helpful. Evening primrose oil. I feel bad that this wasn't mentioned earlier, but honestly, exercising regularly and nutritional diet, these things can be extremely helpful when it comes to the perimenopause stage. We're trying to reduce stress. It's just very, very beneficial in helping the body acclimate to this not an easy stage in life.
No, definitely not easy, but I think that we all can come through it. And I think this is very helpful. Just one final question. For someone who's on birth control and doesn't get their periods, which is maybe great for Tahara, I'm just wondering if they should be getting off at some point so they can actually see what's going on with their bodies and see if they actually are in menopause, or is there another way to find out if they actually finished their periods?
Yeah, so definitely they should be checking every 3-4 months, let's say every 4 months. In general, women that do take birth control for extended periods of time, we do recommend to take a break. Usually the body will let you know, like there's breakthrough bleeding and things like that, that at that point you say that's your body letting you know that it's time to take a break. So we do recommend taking breaks, and maybe every 4 months, 6 months, something like that, just to see where, take a break, let a period come, let's see where things are holding.
With the IUD, you wouldn't be able to do that as easily. You can't just
Correct.
remove it at will.
Right. No.
Then you start,
No.
yeah,
Yeah.
this
So
is
an
the
IUD, An IUD you're keeping in for the 5 years usually. And again, an IUD that's just getting trace amounts of progesterone, we're talking minimal amounts, is really not something that, is a big deal. So when they switch it out, they could switch it out, even go for another 5 years before they, a lot of times we like to say, if it ain't broke, don't fix it. There's nothing wrong with into menopause a little bit. If everything is working, there's no Tahara issues, there's no major side effects. It's okay to go a year or two into it, nothing's going to happen. And at some point, yeah, it will be prudent, I guess, to check and see where things are holding. But yeah, with an IUD, I wouldn't say that that's an issue.
This is so helpful. So how can people reach you, Tahareinu? Because I imagine that people have their very specific questions to their specific situations. So this is
Absolutely.
very broad and very informative,
Right.
but broad. And no one should really
Right.
take advice just from our conversation here. It's like really work it out with your doctor or talk to Tahareinu, work it out with
Correct.
somebody. So how
Correct.
can they reach you?
Yeah, so they can reach Tahareinu through the hotline. It's 1-800 for Tahara. That's, as mentioned, over 50 highly trained advisors that are ready and willing to hold the woman's hand really and walk her through the intricacies of whatever she's going through. The beauty of the hotline is that it's completely anonymous. It's a confidential hotline. You get yourself a case number. A lot of times people, they want to call me specifically, and hey, I'm not on the hotline. The beauty of the hotline is that you have a system. You go into the system and you always pick up from where you left off. So that's a major mile. Like, I don't mind having a conversation. You call me in 2 weeks from now, after I spoke to another 50, 60 people, it's very difficult to keep track of who I told what to and where people are holding. I'm happy to always make myself available for whoever needs, but I highly recommend calling the hotline because you have a case manager. There's a record of what you were told, what you've tried, what's worked, what's not worked. And again, as mentioned, it's not a one size fits all. When you're calling, you have to know that it might take a little bit of time till we figure out what works for you. You're going to get a lot of information. You'll be able to discuss it with your doctor and see the different options out there, and be empowered to make a decision that works for you.
So if someone's calling Tahareinu for the first time, what kind of information, how do they prepare for that conversation so that it's really a productive conversation?
It's really nothing too major. They're going to ask the basic demographics, age and what's going on. Really, that's what they want to hear. But it's important that you should know any medications that you're taking. That's important to know. If you're driving in the car or whatever it is, maybe not the best unless you know by heart all your medications and dosages and things like that, because that is important. That's going to be a question. And even if it's not hormonal medications, a lot of times thyroid, there are other medications out there that do interact with hormones and hormone medication. So just important to know what medications you're on. That is very important. Aside from that, just a pen and paper to be able to write down any useful information that you get, any points that you're going to discuss with your doctor is always very helpful to write down, so you're comfortable and you come to the doctor with a little notepad and you're empowered. It's a different experience. It's a whole different experience.
So in other words, like really make this what you're doing, not driving or doing something else or have kids around. Just like really make this your focus when you're having that phone call. Just have that phone call.
Highly recommended. Highly recommended.
I could
Yes.
just imagine trying to remember all these terms that you're using and all the medications is just overwhelming. So
it's a lot, right?
Yeah. So thank you so much. There's just so much, and I really hope that we've helped several people with this. So thank you.
I hope so. I appreciate the opportunity, and on having an organization that helps women in this stage. I think it's a very, very, very chashuv thing, and I wish you a lot of atzlach and siyata d'ishmaya.
Right, thank you. Thank you for joining me in another fascinating conversation about midlife. If you'd like to reach me, Devora Kresniansky, to talk about your midlife or anything else, you can reach me at jewishmidlife@gmail.com. You can also find us on our website, jewishmidlife.com, and follow us on Jewish Midlife on Instagram or Facebook, and join our conversations in our Facebook group at facebook.com/groups/Jewish Women Talk About Midlife. and share what we're doing with your friends and others in the midlife phase.